to the lesson Acting versus Avoiding. This lesson is designed to help you identify the role and scope you may have regarding important decisions, documentation, and activities that need to be completed relative to your loved one and their diagnosis. As a caregiver, it's possible you may not be responsible for many of the administrative duties that need to be addressed, but it's always helpful to understand what documentation or paperwork is already completed and what still needs to be done to ensure you or your loved one are not worrying about answers to important questions during an illness. Knowing where health insurance cards, an agent's phone number, policy information, will or trust paperwork, or a list of prescriptions is located could be key to less drama and more time enjoying each other. Avoiding or delaying making these decisions or not knowing where paperwork is located only adds to the stress of an already challenging situation. These types of decisions are not predicated on whether or not the disease progresses or your loved one experiences a complete recovery. These activities should be done regardless, if not already. The key question we will explore in this lesson is what decisions need to be made and what paperwork needs to be completed before and during the diagnosis of a difficult or terminal illness, and who should be involved. Throughout this lesson, our goals are to understand what decisions need to be made before or during a challenging diagnosis. We need to understand what role you, as the caregiver, or maybe someone else should play in making those decisions. We also want to be able to identify where important paperwork is located and who to contact if documentation or information is needed. Let's start with an example. My husband was a great planner, and he made sure important decisions were made early in our marriage, long before we could have ever anticipated what was to come. We had put together our wills, had health care, life, and disability insurance in place, and had assigned each other the role of healthcare advocate. The fact that these things were done and documented long before we received his diagnosis of early onset Alzheimer's alleviated, as you can imagine, a tremendous amount of stress for both of us. On the other hand, my mother, who had been diagnosed with lung and brain cancer, was still making several important decisions while in hospice, including what should happen to her home and her other assets once she passed. In some ways, I think she avoided these decisions because she didn't want to appear as if she was, quote unquote, giving up. I can't express the level of stress and emotion this added to those last few weeks of her life. When we should have been spending that time very differently. And we knew if those decisions were not going to be made, that a third party or a court might make those decisions for her. Let's think about these decisions by category. In this lesson, I've only included 4. Let's talk at a high level about legal, healthcare, insurance, and end of life. In regards to legal considerations, ask yourself this question. Have you or your loved one worked with an attorney to establish a will or trust, or has their wishes been documented to ensure their assets are protected? Many of us are uncomfortable, I get it, engaging an attorney, but to protect all parties involved, putting together even a simple will can alleviate many avoidable misunderstandings. Now let's talk about your loved one's health care. Who will be making healthcare decisions if your loved one is not able to do so? Who will ensure your loved one's requests are carried out? This is also something your attorney can help you with. Your loved one, if able, should assign a healthcare advocate and make clear to that person what decisions they want made if they're unable to do so and communicate. Relative to insurance, what policies are in place and are they up to date and easily accessible? Policies such as life, healthcare, disability, auto, home, and a range of other documents should be reviewed and decisions made regarding changes or adjustments. Those changes may include, for example, beneficiaries on a life insurance policy, or adding a caregiver as a driver on automobile insurance, making sure that medical cards are readily available. Now, end of life decisions I know are uncomfortable but necessary. What are your loved ones' wishes relative to those end of life decisions that need to be made, including the details of a service, such as a funeral or celebration of life, or other preferences, such as burials? I want you to use your notebook or your journal to reflect and document your response to the question: what is my role in helping my loved one ensure key decisions have been made, and that any decisions that impact how I care for my loved one have been reviewed with me so that I can support his or her wishes? Again, you may not have a big role in these types of responsibilities, or your role may be very significant. But having a clear understanding up front about who is responsible for certain decisions and certain paperwork will help minimize and alleviate a lot of stress. There are several circumstances where you may need to know where information is located, and we talked about a few. But let me remind you, for example, an emergency room visit will require you to have quick access to your loved one's healthcare insurance card and information. If you need further support with in-home or nursing care help, access to policy information that needs to be filled out for paperwork is a must. Again, making sure this information is stored in a safe place and accessible when needed helps things go much smoother during the continuum of care. So let me pause again and say, you are amazing. I've been where you are. I know what this is like, and I know it can be overwhelming. But making these decisions early and agreeing on where things are located is going to help that journey quite a bit. Congratulations, you completed the fourth lesson in the Caregiver Journey program. Now, go take on the day.